Global Fund Round 7 is mandated to implement the civil society component of the program, basically dealing with the HIV and AIDS programming within the care health sector. And the services we provide with this program, we don't implement directly. We work through partners. Our role is to work towards achieving 3 objectives of the program. And one of the objectives is increasing access to HCT services. Secondly, we are also working towards increasing uptake of treatment and care services. And finally, we have the 3rd objective of building the capacity of CSOs to be better placed to provide these services.
We have guidelines in which we use that we did develop jointly with the private sector, and they were adopted. And these recommendations bring on board 3 key players. It is called a tripartite. We have the employer, we have the employee, and we have the government. And all of them have specific roles. When we talk of the employer, we are looking at parties that have a general consensus that they represent the most representative bodies of employers. When you look at the employees, you are looking at the bodies that represent the most representative bodies of employees. In this country, we have been having central trade unions that represent that is COTU. In Kenya, Federation of Kenya Employers has been spearheading that, and the government has been in the midst of it. So through that, then, we're able to develop specific policies that are specifically tailored for that sector.
The understanding of systems theory and people dynamics enhances the effectiveness of formal and informal workplace development. Most effective human resource people are those who are sensitive to the needs of the individuals and the organization.
Among the various SDAs, service delivery areas, we have the workplace behavior change communication, under which we have 2 sub-recipients undertaking the service delivery area, and that is the National Organization of Peer Educators, also known as NOPE, and Zinduka Africa. We being in monitoring and evaluation, mainly we track 2 key indicators under that service delivery area, and that is number of workplace, sexual and behavior change and communication events conducted, and number of persons reached with sexual behavior change and education messages that were sensitized. And this is done on a monthly basis.
HIV/AIDS, STIs and other health concerns dramatically affect labor, setting back economic activity and social progress. The vast majority of people living with HIV and AIDS worldwide are between the ages of 15 and 49, in the prime of their working life. For the sake of development of the organization, there is a need to take this course of action, since the government may not be able to take up the commitment at a small-scale level.
What we realized is that many of the private providers are normally left behind. The government providers benefit from a lot of CMEs, continuous medical education or continuous professional development. But the private sector, most often they do not have access to this opportunity. So we ensure that the quality of services provided by the private is at par with the quality of services provided by the public sector.
Initially, there was issues to do with stigmatization, so people watu walikuwa wanakaa tu hivyo. There was basically stigmatization, so we can sensitize the workers to do away with this.
Before hawakuwa wakiongea kuhusu condom. Kwanza hata ukiguzia watu kuhusu condom ni kama unawaletea mambo ingine yenye yani hawajui ama hawaelewi, kwa sababu wengi wetu wenyewe hawakuwa wanajua kuhusu mambo ya condom. Unaona? So baadaye baada ya kupata mafunzo tukakuja kuwafunza jinsi ya kutumia condom, umuhimu wa condom. Yenyewe Pia tuliweza kupata kondom kwa hizi hospitali, wakatuletea hapo kwa ofisi yetu, tukawafunza jinsi ya kutumia through demonstration, wakakuja wakaelewa na wakajua umuhimu yake.
One major challenge in relation to the workplace service delivery area is the stigma and discrimination surrounding HIV and AIDS. Persons in the workplace, be it formal or informal, are not coming out openly to declare their HIV status. And often than not, we are forced to do the sensitization blindly without really having to know whether you are living with HIV or not. So we in program, in CARE, in partnership with the sub-recipients undertaking the service delivery area, we undertake massive anti-stigma campaigns in the workplace, both formal and informal, to at least encourage persons to come out openly and declare their HIV status so that the messages can be packaged accordingly, depending on whether someone is living positively or they're HIV negative, and also encouraging those that are HIV negative to continue living negatively.
Workplaces that care for the individuals are the most productive. Having a workplace policy is very important in ensuring that organizations are effective in meeting both their goals as well as the needs of the employees.
The policy focuses on, one, the company acknowledging HIV as a workplace issue. You have to bring the company to a level whereby they understand that HIV and AIDS, if nothing is done about it, then it's going to eat into their productivity.
We have a workplace policy on HIV and AIDS long before 2008. Its aim is to promote sound management practices, to motivate our workers, and to train them in regard to HIV and AIDS and how to learn more about it, the prevention and the care.
At the end of the day, we find the company having good production. Of course, if the healthcare of the employee is good, definitely we expect work being done in the company, the production becomes high, and it becomes a benefit for both of us, the employer and also the employee, in one way or the other.
This stems from the understanding that employees might be more productive if personal problems were taken care of. Incorporating the family as well as relevant community institutions is vital for the success of this noble idea.
We have a clinic facility within the farm where we give treatment to all our employees and their dependents. It's free for all the employees, and for the dependents, the guarantor with the employee caters for half the bill and the employer caters for half the bill.
Our workers, they prefer going to a facility since we've gotten used to each other. We understand each other's problems and we work as a family. So they would have no problem approaching any of our staff. They would get advice like they would get from a parent or a friend.
We talk about each and everything. We always have different topics each and every day. We always create an awareness on HIV. We always demonstrate on how they're supposed to use the condoms, on how they're supposed to be faithful, on how they're supposed to trust each other, and on how they should also be frequenting the clinic facility for their counseling and testing services.
The health system in particular is one very sensitive issue which needs redressing, especially in view of the health crisis caused by the AIDS pandemic. HIV and AIDS epidemic needs a holistic approach to be tackled, hence the need for organizations to put in place policies that support structures that are meant to raise awareness among employees in both formal and informal sectors on dangers of risky behavior with regards to the prevalence of the HIV virus.
Sisi kwenye matatu tunapenda kutumia pombe juu kulingana na pesa tunapata haraka haraka, na hizo zinafanya mara mingi mtu akishalewa ana end up anapatana na dem bila kutumia protection. Sasa pombe ni njia moja ya kufanya sisi kama watu wa matatu tunapata na hizo risky behaviors. Then ingine ni wale mademu. Kuna wademu wanataka Munguleta katika sekta yetu. Munguleta inamaanisha dem amekuja kwa stage, ameona na gari fulani, ameona hiyo gari mzuri kwake na anataka kukaa, anakuja hapo mnashinda naye the whole day. Usiku inafika, ana any other alternative place to go. Mnatoka naye hapo kama ni either driver au ni conductor, mnaenda naye places niona kama mali kama coast. Isipokuwa sisi tuko Nakuru, it's rare. Nakuta wale watu kwa matatu wanapenda kushare drugs zile za kujidunga na shindano. Sasa kama mimi ni best yako, ukishajidunga, pengine hiyo pesa sitaki kwenda kununua nyingine, tumia the same drug na jidunga, na katika hiyo shindano hiyo inaweza get infection.
Sana changamoto ya kuhusu health yenye tunapata kwa hii baiskeli ni kwamba mostly wenye wanapenda hii kupanda hii baiskeli ni ladies. Wanaume ni wachache sana ambao wanapanda baiskeli. Wana prefer pikipiki na tuktuk. Na sana sasa ikifika wakati wa usiku, sasa ndio tunakuwa na changamoto kubwa kwa sababu most of the ladies ambao wako hapa town, wengine wao ni ma sex workers, unaona. So saa zingine unakuta unambeba, unamtoa hapo town na kuambia mteremushe chini, tena nakutoa mbio mteremushe faster kujua kuna mtu ambaye anamtegea chini. Sasa uenda ukimshateremusha chini akose huyo mtu, wajua sasa na huyo mtu ndiye alikuwa anatarajia kuja akulipe, unaona. Na unakuta huyo mtu labda amembounce, unaona. Sasa atakuuliza sasa, boda, nimekosa huyo mtu na huyo mtu ndiye alikuwa akulipe, sasa tutafanya aje, unaona. So unajua si boda pia tunasema mimi nataka pesa yangu, uone vile utanili. Kwa vile sasa hata yeye anapiga hesabu, anaona hakuna alternative, anakuambia sasa unataka nikulipe aje? Mimi sema tu chenye unataka, sasa nitakupe. Unajua sasa baadhi ya boda pia wetu ni vijana ambao bado wamechangamuka, unaona. So unakuta mtu anasema sawa basi acha hata kama tunataka kumalizane, juu mtu najua ulikuwa naenda kumalizana na yeye kipango ingine, hata mimi si nipe tu tumalizane hivyo. So unaona, kwa hiyo harakati unajua boda hakuwa na hiyo mpango ya kwamba anaweza pewa kitu kama hiyo, unaona. Kwa sasa hakuwa amejitayarisha, ana CD.
These structures ought to be supportive, where employees are encouraged to be truthful and know their status so that counseling can be offered by professional counselors so as to promote productivity. Such structures include support groups within the workplace.
These people need time off to go out and seek medical advice, collect drugs. The rate of stigma and discrimination has come down, noting that those who have come out in the open, they are being appreciated, they are being noticed, and more to that, the management has come out with a project that grows vegetables, indigenous vegetables, where they are given for free.
Training peer educators within a workplace who in turn form peer educators clubs to inform colleagues about HIV, STIs and other health concerns.
Basically in the farm, we sensitize the workers on their ways of living, issues to do with HIV, family planning, condom use and such things, yeah.
Sometimes you'll find that people have the fear of going to get the condoms from the dispensers. So we also always use the peer educators, of which we have representatives of peer educators in each block, so that if they have issues on having condoms, they simply come to the clinic facility, get the condoms for their peers and go and distribute to them.
Sisi kama peer educators, we normally go for trainings. We normally go for Westman Forum and couples forums. In couples forums, una engage peer educators and the peers. Pia unakuja na familia yako, yeah, that's a spouse. Unakuja na bibi, tunafundishwa mambo ya HIV, sometimes tunafundishwa mambo ya family planning. So through those forums unakuta kama ule mwenye si peer educator ana get knowledge on HIV, then spouse wake still ana get knowledge on HIV mwenye anazafikishia maka wale wenye majirani wake nyuko katika manyumbani zao.
Having drop-in centers where workers in the informal sector can access information.
Maskani means is a cubicle where those people who are so much together can come and interact with each other. So in those maskanis, we have put something which can attract them to come to the facility, like pool tables.
Because of so many deaths occurring among employees, increased strain is put on the recruitment efforts and productivity is impacted negatively. Against this background, it means that it is difficult to maintain continuity with work assignments. Hence, there is need for a comprehensive health and education awareness program at the workplace, in addition to giving extensive counseling as far as the HIV and AIDS pandemic is concerned.
For those of us in the labor force, often we are tied to our work from day one, from Monday to Friday. Hardly do we find time to visit health facilities to access some of these HIV preventive services. So the workplace service delivery area in terms of sexual behavior change communication brings the services closer to the people, where there's synergy of HIV counseling and testing during the sensitization events. There's also condom distribution, and there's information, education, and communication materials that are distributed during the events to support the behavior change communication revolving around HIV and AIDS.
For employees, employment performs many functions, including the provision of financial rewards, opportunities for expenditure of time and leisure, meaningful life experiences, as well as supplementary social interactions. If employee needs are taken care of, then the benefits are to both employer and employee.
Kuna baadhi ya vitu ambao nimesoma kutoka hapa, hata nimebenefit kutoka kwa hii kampuni. So naona hii kampuni sio mbaya. Hata ukiangalia venye nimevaa, mahali ninafanya, nimekuwa well protected. Ni kama wakati walikuwa na offer ya circumcision, waliruhusu kila mfanyikazi ambao alikuwa na hitaji, the one who is willing, ambao kuna baadhi ya watu ambao walifaulu kuenda kwa kitu kama hiyo.
A big number in matatu industry hizi wanajua mambo ya kuprotect themselves from infections. Haswa sisi kama pia educators lazima to make sure tumeenda kuchukua condoms na tuko na dispenser outside here. Ndio wale mwenye anataka kutumia, kama pengine afikiri kutumia pesa yake kwenda kununua, kuna mara anakuja apate ya bure.
With the policy and the peer educators at work and the clinic facility in place, we've seen a dramatic change, and we continue supporting our workers, our peer educators in the clinic.
Myself being an employee of the facility, I have benefited because not just me, my family has also been able to benefit, also the community around, because many things have come out from the facility and down to the community level.
In our quest as Kenya to attain the Millennium Development Goal number 6, which is combating HIV, AIDS, malaria, and other diseases, the fight for stigma and discrimination cannot be overemphasized. And I believe this can be achieved through the workplace behavior change communication messages.